Good morning. We have with us today Dr. Indra Jayasuriya, endocrinologist, who will be discussing with us thyroid disorders. Good morning and welcome, Doctor.
Good morning, Saliya.
Doctor, when you talk about thyroid disorders, how would you describe thyroid disorders briefly?
Yeah, thyroid. First of all, I like to mention about the thyroid glands. All of us has a small gland in the neck, which looks like a butterfly, which called the thyroid gland. So we need thyroid gland to live. So it control things like body temperature, body weight, metabolism, and so many other functions.
Is it a very hormonal function, Doc?
Yeah, so the 100% thyroid has a hormonal function.
And what are the disorders in the thyroid gland?
I mean, there are various disorders affected by the thyroid gland. So as I said, all of us, all animals has thyroid gland, and depending on whether thyroid function normally or not, you can get various type of conditions. Yeah? So there are sometimes the thyroid works over, then you get a hyperthyroidism or overactive thyroid. And the other time, thyroid may not work as it usually does. We call hypothyroidism or underactive thyroid. And the other times, we can get other conditions. So the thyroid has a normal function, but thyroid can grow in a different direction, so which can cause, commonly we call the nodules, so the growth in the thyroid gland, or you probably heard goiter in Sri Lanka. In the past, we used to see people with a large thyroid, which called goiter.
Doctor, when you have a overactive thyroid, what are the symptoms and what are the disorders that you have from an overactive thyroid gland?
The common symptoms are usually weight loss, and you may get palpitations, which is a rapid heartbeat. People get tired very easily. And one of the main symptoms is the temperature control. So the people feel hot all the time and night sweats. So those are the main symptoms. But then depending on the age, so those symptoms quite common in younger age people. But when you get more into the advanced age, people have the non-specific symptoms like eating difficulties, muscle weakness, having frequent falls and things like that.
How does it happen? How do you have an underactive or overactive thyroid?
Okay, so the first overactive thyroid, so this is a common condition, that can cause by various ways. Again, I mean, more younger age people, particularly the younger females up to sort of middle age, can get overactive thyroid due to sort of general enlargement of the thyroid gland, so which condition called Graves' disease, GRAVES, which mainly we call autoimmune. So that means your own body fighting against the thyroid gland. So our body produces something called antibodies. When we have a cold and flu, we normally get antibodies. So this similar sort of mechanism can cause antibodies against the thyroid gland, which make thyroid to become very overactive. So that's called a Graves' disease. So that's the commonest cause for the overactive thyroid in sort of youngish, middle-aged people. But when you get more older, which mainly due to nodules in the thyroid or the goiters, which can cause excess production of the thyroid hormones by these specific nodules. So that causes the overactive thyroid. Very rarely, the other causes include some of the medications you use. Some heart medications can cause overactive thyroid, and also viral type infection type things can cause overactive thyroid, which tend to be more sort of transient, or which get better most of the time spontaneously.
Once you have these signs, what's a medication and do you need medication for the rest of your life, or how does it work?
I mean, it depends on the cause. So if you have any of those symptoms, and I'm sure your local doctor will check your thyroid function, depending on the level. So we can put medication to stop overproduction of the thyroid hormones, and sometimes you might need different medications to slow down the heart and things. And then you will need a more sort of a scans and things to find out exactly what causes the overactive thyroid. So depending on that, in long term, so you may get better with the medications, usually for up to 12 to 18 months treatment, or sometimes you might need, something called a radioactive iodine, particularly if your thyroid is, part of your thyroid is overworking, and sometimes the thyroid is big, or if you have any problem with medications, then you might have to have a surgery.
So if it enlarges, can it be operated? Can you take them out?
Yeah, but there are again various symptoms can occur with enlarged thyroid. So not if you have enlarged thyroid, not necessarily you need surgery. So there are specific situations we usually refer to the surgeon. For example, as I said, if you cannot tolerate medication or various reasons, if you can't have a radioactive iodine, then obviously you need a surgery. So the other time, if you have a big goiter or the big thyroid, then if you have a swallowing difficulties, or if you have a breathing difficulties, or change in voice, or particularly a sort of young people, cosmetically,
Yes.
if it's not look right, then you probably need a surgery.
And then what happens when there is overactive thyroids?
So that's
underactive thyroids.
Yeah, so that's opposite. So that means your thyroid is not working, which is probably more common than the overactive thyroid.
Okay.
Again, it is more common in females.
And what are the symptoms?
Yeah, usually they gain weight. So that's probably the most commonest symptoms. And when it gets worse, so they feel excessively cold. You can get other symptoms like tiredness, lethargy, sleepiness, constipation and things. And if the thyroid is severely underactive, then you can develop coma
As well. And it's the same way that you treat them?
It's a different way. For the underactive thyroid, there's only one treatment, so we have to use a thyroid hormone replacement, so called thyroxine. Yeah. Again, it is more simple to treat than the overactive thyroid, because all the causes is only one treatment. Yeah? But then you have to see the doctor regularly to adjust the thyroxine dose in order to get it right.
This talk about lack of iodine in salt and stuff like that, could that really create underactive thyroid?
Yeah, so that's a good question. Is the underactive and overactive thyroid can both caused by iodine deficiency or excess iodine. Yeah, so that's why I mentioned earlier, some of those heart medications can cause overactive thyroid, because those medications has excess iodine. The goiters also can cause by low iodine, so that's why people in sort of mountainous areas tend to get goiters and underactive thyroid. And particularly, in Australia, so like places like Tasmania and some of the Victorian towns like Traralgon and things, they used to have iodine deficiency in the soil. So that cause significantly increase a proportion of people getting these conditions. But I think these days, majority of us uses iodide salt, which tend to prevent this kind of problems.
So is it brought on by diet, or is it hereditary? Could it be history that you have, say, parents, grandparents having problems with their thyroids that create this issue?
Yeah, in a lot of cases, there are hereditary component and also environmental component, as we mentioned, iodine deficiency and the medications and other things. So that there's a strong genetic component. So it doesn't mean that the parents going to inherit directly to the children. So maybe you get thyroid problems. Maybe on the lineage, your grandparents or someone might have a thyroid problem. So it's not one to one, but there's a high likelihood of getting thyroid problems if there's family members with thyroid issues.
Being an endocrinologist, you would probably see a lot of these cases. Is it a very common thing, or how does it work?
The thyroid disease are very common. So usually females tend to get more thyroid problems than the male. Again, depending on the Asian people tend to have more thyroid problems than white people. and again, when you get older, so you tend to get more nodules and big goiters than younger patients.
And what would you say would be the preventive if you know that you got a hereditary problem? What are the kind of, you get them to test blood tests and stuff like that, or is there preventive?
It's a good question. It's difficult. Really, it is difficult to prevent apart from taking iodide salt. And the main thing is, if you have a strong family history of thyroid problems, get thyroid test done maybe once a year when you're having other blood tests done with your local doctor. And particularly it's important if you plan to get pregnant, have a thyroid test done if you have a family members with thyroid issues, because sometimes you might need thyroid hormone replacement during the pregnancy just to keep the thyroid level low. But in here, we now tend to check thyroid test as a part of routine test for many pregnant women early in the pregnancy.
Okay, so that's a great insight into the abnormalities of thyroid glands, and thank you very much for giving us a good insight into that.
You're welcome, Saliya.